Hi, my name is Christina Katka. I'm a social worker with the Maternal Infant Health Program, which is a home visiting program for pregnant women and infants in Washtenaw County who have Medicaid insurance.
My name is Kim Schultz. I'm a nurse. I also work with the Maternal Infant Health Program.
And Jennifer Ellsworth, I'm a dietitian with the program.
So a typical day as a social worker in the Maternal Infant Health Program, we all start out, with having a certain amount of visits scheduled for the day, often trying to confirm with the families that we work with. The plan is to see them on a monthly basis. However, we understand that a lot of our families have a lot of different needs, and sometimes those basic needs of maybe getting a ride to the grocery store or someone can take them to a ride somewhere else might trump kind of what our visit might be able to offer. So we do spend a great amount of time of coordinating just to make sure that families are getting what they need. So we can generally schedule 3 visits in a day and maybe realize that we might not actually see those people, but we recognize that they have a lot of different needs kind of pulling them in different directions. So a lot of it, we might check in the office in the morning, get our visits scheduled, grab all of the paperwork or supplies that we might need. Sometimes families are needing food. We're fortunate that we have a food pantry here that we can pull some resources from. We also have diapers and safety items that we're able to take out to families if that's something that they are in need of. So we might gather those things and then kind of head on our way and potentially be out in our car or in someone's house for the majority of the day. It's not an office job. There's a lot of flexibility to it, but it's also really nice to go into people's neighborhoods, see where they're living, see, kind of what some of the challenges are, so what's the strengths of the neighborhoods, and really help families navigate their community.
As far as a nursing role, so you're probably guessing as you listen to this video that there's a lot of similarities between the nurse and the social worker. Obviously, we both bring our own viewpoints to the care of the client in our own professional experience and education. Specifically for nursing, although it's not a clinical nursing role, we weigh babies, we measure babies, we talk a lot about growth and development. I think a big thing for me is explaining the growth chart, because the pediatricians don't necessarily have the time in those doctor's visits, and the nurses, they're tight visits, and we have a little more time with the patient. So a lot of my role is kind of adding on to what maybe the doctor said or the pediatrician said or what the experience was at the urgent care last weekend. Even liaising with the doctor's office, I think they have a picture of the client when they see the client for a short snippet of time, and then I have a viewpoint of being in the home. So sometimes the doctor might feel a client's being uncooperative and not coming in for visits, where there's sometimes more to that story. And that's kind of where the social determinants of health come into, and why isn't that client getting there? Is it a transportation issue? There's a lot that goes into it.
Well, as the nutritionist, I kind of come in secondary. The social worker and nurse get referrals, and they're the ones that do the initial visit and assessment of all their needs. And if it looks like there's a feeding and nutrition or breastfeeding issue, I get called in to help with that. So I may see clients just once or twice. Sometimes I'll see people more than even they will if the feeding is the most important issue that's going on. But yeah, we're assessing health, we're referring to other people, we're managing the case log, we're charting, and all those things are happening pretty much all day long.
So the Maternal Infant Health Program is a multidisciplinary program. We have social workers, nurses, and dietitians if there's a nutritional concern. And so we often collaborate to help families with whatever's going on with them. Last fall, I believe it was, we had a little kiddo who had a really difficult time right from his newborn stage. He had kind of excessive vomiting, really had a difficult time with weight gain. I initially had gone in and did an assessment to kind of get an understanding of what was going on with the baby and with mom, and at that time came back to the office and immediately referred to Kim, our nurse, and then Jennifer, our dietitian, to kind of help mom come up with a plan to help this little one gain some weight.
So baby was born, they were twins and 32 weeks, so young, and We did a lot of different things in the beginning, but the weight gain was an issue. Jennifer helped out with the formula. There was an ongoing of months trying to figure out what the issues were. And the nice thing was one of us could go on a visit and come back and tell the other ones what's going on. It was really helpful to the client to have that streamlined care.
Yeah, I focused on formula tolerance, trying to determine if it was formula intolerance or gastric motility issues with weight gain. That allowed Kim to focus more on developmentally what was happening with the child. Turns out in the long run, everything was related together, and once the child was 1, the doctors were able to diagnose disability.
Ideally that year we're kind of really helping them, educating them, modeling for them so that they can be a little bit more self-sufficient by the time that they're done working with us.
So a number of our clients do not either speak English or English is a second language, so taking time to using the language line or translation services to help them understand, and then again working with understanding other things that are important and how to access services.